Are we healthy yet? Are we healthy yet,
I don't
guys?
know, but we're live. We might not be healthy, but we're live on the internet. Hello, America.
Amazing, everyone.
Yeah, we're back. It's
Great
February
news.
27th, last business day of the great month of February, the month of my birth and Melissa's birth. And we just got back from Los Angeles. It was wild. We did some interviewing, some fake news, and we also did some speaking. So it was super great. Also, it was Melissa's birthday, in case everybody missed that. I'm sure everybody was watching our show on Tuesday. But in case you didn't, it's her birthday. It was her birthday. Still is her birthday. Birthday week.
Thank you.
Happy birthday, Melissa.
Pooja presented me with the thing, and you guys all sang me happy birthday. It was very...
Yeah, I know. But, sometimes our loyal fans say they watch our show and then show up and have no idea what happened. So I just got to recap it for them. But Lisa's looking very serious right now because she has to submit her comment letter for HTI-5. So, if she's a little distracted, that's what's
I'll be doing that.
Yeah.
I'll be doing that. So it turns out, by the way, thanks a lot. I guess Mike Lipinski, because the due time is 5 p.m. Eastern, which I feel is very discriminatory because I'm on the West Coast. And so, that's annoying. And also because the RFI that was due on Monday was due at like midnight Eastern, which is a fairer time. So I just have some thoughts.
Yeah. Listen, we don't know if that was you or not, Mike Lipinski, but if it was, we've got some things to say to you. Also, look, our special guest for today just showed up a little late here. This is
Hello,
Mr. Al Guida Jr. Oh my gosh. So, okay, you got it right, Al. We're just going to send you to the back for 30 minutes. So you walking away is perfect. He'll be on soon. We got this guy on. He's going to talk about behavioral health, probably. It's unclear. Anyway.
It goes with the par, guys. I just want you to know it's like par for the course at this point.
Yeah, I'm into it. Whatever. Okay, so a lot of things have happened. Here, let's just go through it. Melissa, anything we throw you out?
I'm taking him stuff, and I have an audio check with our lovely gentleman, Joe, that works with Incenna to make sure I have an audio check so I don't go through the same struggle I went through with our new equipment on Monday. So more to come.
Yeah, listen, America, we finally upgraded.
It was an adventure. It was a big adventure.
I was crying.
Yeah, but you know what, Melissa, you made everybody love you. Like you turned those
Always.
tears into tonic water. I don't know what the hell you did, but it worked out. So anyway, okay, send you to the back, Melissa, and Lisa and I will go through some news and exciting developments, and some non-news because this is a non-news show. So
correct.
We were at ViVEvent. We both spoke.
Yes.
This was a panel. Obviously, the panels we spoke on were the best panels, in case anyone didn't notice. They also may be the only ones that I attended. So this is our rundown of ViVEvent 26. Yeah, so I did this panel with Dr. Daniel Carnegie, who is the Chief Data Officer of North Carolina, Sarah Lampe, who's the CEO of Prime Health, also a former public health professional, and Dr. Brandon Talley, who's he has a new fancy title. He's basically number 2 at CDC Foundation about, what opportunities we have to innovate. So cool stuff. Also, somehow, because of my personality, got on stage with these fine gentlemen, CEO of Tampa General and CEO of Cedars-Sinai, talking about how hospitals can still make some money or at least not die in the new restrictive reimbursement environment. So that was cool. And then Lisa, this is such a cute picture. Oh my God. Lisa talked about some nerd stuff with pharmacy. Tell us more.
Yeah, with NCPDP, the National Council for Pharmacy programs. And they're very sweet, thanks to our friend of the show and friend in real life, Pooja. And got to talk about their patient experience identifier and talking about sort of connecting pharmacy data and pharmacy patient experiences together on the back end. Yes, it was very nerdy. There were shockingly a lot of people there. It was kind of crazy. For the nerd topic.
I think that stuff like this, the nerdier, the better.
Yeah. No, it was great. It was great.
That was super cool. Lisa and I and Melissa, who is not pictured here, but very much in scene, interviewed a bunch of people for the talk show. We continued our reign of terror. Also, Melissa continued her reign of terror on all conference and convention centers. So
She's like they hate to see her coming. She's gonna
They do. They hate to see her strutting in. They know they're gonna have to give her all kinds of free stuff.
She's like, so listen, I need you to get me this, do this, move here, that. Always makes it happen. Always makes it happen. Oh, it's so good.
It's like, look, can we just make fun of this for a little bit longer? So we've now been to the Venetian Sands Convention Center like 3 times or something as the talk show. I can't remember. The staff actually remembers her.
Yeah, she's a known quantity, like fully a known quantity.
Yeah,
it's amazing.
So I will say, because of Melissa, we do end up with decent spaces that we probably don't deserve. So thank you, Melissa. You are a champion.
That's right.
Anyway, here's us interviewing our special guest, Abe Sutton. I thought he was a great guest. I thought he was going to be all buttoned up. I mean, he was, but you know.
No, Abe, I've known Abe for a number of years. He's super charismatic, really well spoken, really like very passionate about the work, like good dude. And like, yeah, and Guida, this is his chief of staff as well, who was with him. You know, they were both great. Although Abe has definitely had his media training. Good dude.
Oh,
like
yeah.
truly just like,
oh yeah,
impressive.
He could do a couple bridges away.
He could walk run a few circles around us like this.
And he did laugh when we were like, that was a nice dodge. Like,
no, he's not. No one is pretending here. Anyway, he's great. He really does know his stuff, and like he's just really passionate about the work. So it's good to see. Heard some rumors that guy might be moving up in the world. We'll see if that's true or not. We'll see if that's true or not.
You know, I will say this about rumors. Obviously, I love them so much, as you know, Lisa. But like we've heard like the craziest rumors, and like a lot of them are like deep state campaigns to like get people out or move people up or whatever. So I don't actually freaking know.
I don't know.
I've found that the best thing to do in the case of rumors like this is to just hang out, because hang out
and see what happens.
Yeah, there was a rumor going around like last year in the summer that Chris Klump was out. And now he's freaking running HHS. So like,
that one didn't turn out to be true, right? Like, I don't think that, don't think that one ended up to be the case.
So we had a lot of great guests.
Or you know what? Behind the scenes as well, there could be just an entire Game of Thrones happening that we don't know anything about.
I mean, that's the thing. Who knows? I would not have expected Game of Thrones to be won by the wheelchair guy. So, I don't know. We'll see what happens.
That's true.
We had a lot of great guests. Abe was great. And I don't think he told us anything like totally wild. He did, we talked a lot about affordability, the consumer directed stuff, which is cool. Also said that he doesn't think ACOs are going away. That was cool.
Well, it is kind of his job to say that they're not going away.
I don't know. He could be a little edgy. He could be honest with the American people on the talk show.
He's
anyway.
Good.
It was
These guys
great.
are smart. They were great guests, super fun. And I think we can maybe say now we have another very special guest. We're not going to say who, we're just saying we have a very special guest.
Yeah, we're having a special one-off show at HIMSS, much like we had with Abe. So stay tuned. We will probably let you know when that is, but
we might. But what we can
know.
say is that we're going to at least try to not have the same audio problems. Now, we can't promise anything though. That could definitely go the wrong way.
We really can't promise anything, but well, we'll see. We'll see what happens. Okay. All right. Moving on. Oh yeah. And also thank you to Mascot, best friend of Health Tech Talk Show. Also best friend in audiences, Wayne Grotsky, who deserves a little picture in here. Go Wayne.
Oh, Wayne.
All right. So while we were ViVEving, the State of the Union happened. Apparently it was long. There was lots to say. But there were only 5 minutes of healthcare related things to say.
Yeah, I mean, right. So the drug prices things, which as everyone knows are like not really our thing. Like we're not super into like drug pricing, but that was the main reference. And saying that the costs have gone down. I cannot comment on the price of drugs per se. I'm lucky enough to not take any of the drugs that are on the negotiated list right now. But yeah, not a lot. Healthcare is still really expensive and hard to access. That's what I would say.
Yeah. He hit hard. Trump hit hard on the most favored nation stuff. High five, Chris Klomp. Everybody loves that. Also, I'm not sure if everybody knows this, but like fraud is really like crushing fraud is super popular with the American voters. So looks like we're going to be doing some of that. As we see here, all of a sudden, I mean, the fraud crushing has been going on for a while in this administration. Our friend Kim Brandt, who's a total baller and hates fraud, has been crushing it for a while. But there is a new emphasis on promoting all that we're doing to crush fraud. Some of which people agree with, some of which people are not agreeing with. One of those things is cutting off all Medicaid payments to the great state of Minnesota.
It's not all Medicaid payments. It's the amount that was, that is calculated to potentially be fraudulent payments. So it's not all Medicaid payments. It's a lot of money. I'm not trying to pretend that like, oh, it's great to like lose out on 300 million or whatever it was, a huge amount of money. Just saying, it's not like all Medicaid payments. But yeah, I mean, it feels obviously quite punitive. However, like this example here, I can't disagree with that, man. Like, I don't think there's that many needs for hospices, and I think hospice and palliative care is incredibly important and probably underused, but probably not to that level.
For our millions of loyal fans who are likely watching us on their iPhones, this is a quote from this article in Politico. It's from Dr. Oz. In this 4-block area of Los Angeles, there are 42 hospices.
Yeah.
So there are either a lot of people dying here, or you get a lot of fraudulent activity that is so good that everyone wants to get in on it. That sounds bad. Yeah. Also, I know Mike Gleason, who was at the ASPE, he talked about that new data set where people are digging through and trying to find the fraud. So I don't know. It sounds like he was saying in his LinkedIn post, Lisa, I don't know if you saw it, that, because you said you have some teams digging in too. Previously this data
we're also looking at the data. Yep.
It was not homogenized. It was not in one place. So it was difficult to see patterns of fraud, and now it is not. So
I love data transparency. Love it, love it, love it. And also, I think I have to go back. I think I observed the moment when sort of the tip off came about the hospice and palliative care fraud or hospice fraud in LA. I think it's a guy that I know who was like, my company looks into this and here it is. So I've got to go back and look. But you too can get the attention of the Trump administration via LinkedIn and X and whatever else if you have something to share with them. Again, this sounds like a fraudulent situation, and certainly it should be shut down.
It does sound bad, but there's some other. I was having a conversation about. I agree. I'm like pro open data too for all things. I'm open to Americans making decisions and finding stuff. There is some. I do think that like not anyone can just dig into this and find fraud. Like as an example, like for home health providers, like often you'll have one physician just like banging through a lot of that stuff. It might look like a pattern of fraud, but it's actually how most of them operate. Like, so, there might, I think just saying like caution, context is useful.
Like just because you see something, you do need to have the context and the experience to understand what's happening. It's not, like you just said, it's not automatically fraudulent just because it looks weird to you, a non-subject matter expert,
Mm-hmm. But anyway, we're here on fraud for a while, it sounds like, because this is popular with the voters and we are running up on the midterms. In addition to all of this, there's been I think it was put out like Wednesday or Thursday of this week. I think Wednesday, there's a moratorium on new DME supplier enrollments across the country for 6 months. Could be extended, or ended early. My guess is it might hopefully just end after 6 months. But this is definitely something we've highlighted in the past on our show, fraud in the DME supplier space. I'm sure there are, of course, some negatives.
This is like a big deal. This is like a really big deal. And like, of course, just like you just said, I, if you ask me where there's Medicare fraud, I'd be like, DME providers, but like not all of them, just to be totally clear, like people, I don't know what's going to happen here, whether, I can only begin to imagine the potential unintended consequences, and certainly hope people will not be harmed because of this, because this is quite an extreme thing. At the same time, again, like when we cut off fraudulent activities in Medicare. So and Medicaid and CHIP.
Yeah, we'll see. I think, again, it is pretty drastic. The exceptions list is not terribly long. I get it. I also think like that's, this is what regulators do. They like smash down the hammer. And there may have been some things they hit with that hammer that were unintended, but I get the point. So interesting stuff. We'll see what's going on here. And if there's anything new that they announce in the fight on fraud. Oh my gosh. Other government stuff. So CMS released an RFI looking for AI tools for Medicare experience modernization. Sounds exciting. Sounds indicative of what's going on in the future and due at the end of March. Lisa, in case you missed writing stuff, you get to do it.
I'm definitely planning on responding to this, but also I'm really tired of writing. Also, this week was a little rough. And you know what? Who do I have to blame besides myself? And the answer is really just myself, right? There was at least like 60 days involved in this. And you know what? We have a lot to do. And oftentimes it goes to the last minute, like today.
I feel like sometimes you'd have a lot of conversations and think about a lot of things. Like as an example here, yesterday, our friend of the show, Ryan Howells from Levitt Partners / Karen Alliance. I'm actually not sure which organization is his primary. I assume it's Levitt Partners. He's like us, Lisa. He's got 400 jobs. But yesterday wrote this nice kind of opinion piece, kind of persuasion piece about how everybody should be responding to ASTP on the HTI-5 rule. Lisa, what do you think? You know what I think.
I mean, I get his point. Like, I totally do. I fall in the middle. I understand that like EHR certification requirements been used to be like, well, I can't do anything else. But that's a choice. Like, it's a business choice, right? Like, I don't know that I would say like if we remove all the certification requirements, EHRs will become more secure. That feels like a bit of a stretch to me. And that said, like as you have said recently, as you have said before, like stand for something, man. Like this is a perspective, right? Like you know what I mean? Like this is not this is Ryan saying like this is what I believe. Like, I feel really strongly about this. And I'm encouraging people who are writing these comments at the last minute, like me, to like make sure that we don't encourage, ASCP-ONC to keep these certifications,
Yeah.
I get it.
Yeah. I do love that like he understood his audience. He's like, none of these people turned this
like these freaking guys.
Yeah. I mean, my opinion on this is like, I don't think they deregulated enough.
Right. Cats like no regulations whatsoever. And I'm saying like, yes, remove some of them. There's a bunch of stuff in there. Also, I'm not going to say who said this because that will give it away in many ways. This is a person who said this mostly in confidence, but I agree with it and thought it was really funny. So I'm saying it again as well. Like one of the things in the comments was so there's a bunch of information blocking revisions and removal of these information blocking exceptions. A lot of HTI-5 is like cutting back regulations, including things that are these specific regulations around exceptions to information blocking. And one of them is unconscionable contract terms, which is basically, let's just say like EHRs putting in all these contract terms with the providers and the health systems and whatever who have contracts with them for their EHRs. And they say, oh, you want to get data out? Well, here's a really restrictive term. It costs $1 bazillion. It's very restrictive, et cetera, et cetera. Yeah. Someone who shall remain unnamed said, TEFCA is an unconscionable contract term. And I cracked up and I was so wanted to quote this person in my HTI-5 comment letter. There's somebody and love and like and it's I just was like, dude, you freaking rock. That was hilarious. That would have been that's what I want. If it were a comment letter from Lisa Berry, that's what I would say.
Was it a man?
Nope. No,
okay. I know who
men
it
don't
is.
say men don't say things that
I know who it is because
smart.
Of the way you did like your voice in your throat. I know exactly who that is. God bless you. Love it. In strong support. Anyway. I just think we should take away all because like here's the thing. I actually do agree that like the more you regulate and you like tell EHRs how to build their product, the more they like resources are not unlimited, right? So you spend all your resources doing, whatever the government tells you to. A lot of it is like you're like, doing weird stuff in your system because it's not natural. End up with a lot of tech debt, and then you actually you don't have the resources to do cool new Epic shit. So I shouldn't have used Epic there, but Yeah. So I think we should deregulate. I think that customer demand and customer satisfaction will win the day, but there aren't many people who agree with me. So whatever.
Exactly.
Provider directories. Yeah. Apparently confirmed here from Bob Herman, our friend at Stat News. No one really has a lot of details.
Well, somebody who does have details was on our show at Vive, CAQH, just saying.
Yeah. What are those guys doing? Do you think they won?
I mean, they might have. They have a really strong posture, right? I mean, so do the others, of course. I would be shocked and very dismayed if Palantir wins. Sorry, not sorry.
Also
Um,
Gainwell.
yeah. Well, I mean, these are huge companies that have a lot of history in the space. I mean, Palantir doesn't have a lot of history in non-defense or like civilian healthcare, but yeah, I mean, I don't know. I would always love to see, an entity or somebody in this role who has been operating the space for a while is a little bit more neutral. CAQH, as we now know for sure, is like owned by health systems and no longer is a nonprofit. That's what we learned at our Vive show.
Yeah.
But yeah, we'll see, man. This is interesting. The way they did this again was a bake-off, right? So they awarded like a $1 procurement to each of these guys and made them do stuff and prove out what they're doing for a number of months.
Who do we want CAQH to win? Who do we love?
I mean, I think Availity and CAQH have like a good,
They
good
both
history
have
in
the
the
data.
space.
Like they both actually have the data.
Yeah, exactly. Like they're in my eyes, they're more credible in the space.
Yeah. Okay. Awesome. Well, we'll see what happens. I don't know. Apparently, it's gonna launch later this year. TBD. Okay. So Casey Means back from maternity leave and has had her Senate confirmation hearing. Not looking good.
Not looking good. I always look at the comments and the tweets from Jerome Adams, the Surgeon General under Trump, who's a good dude. I've met him before. And he's just like, hey, the requirements for the role mean that you have to be a like currently licensed physician. It's like that's what it is. There's no exceptions. You have to be the commander or whatever of the US Public Health Service, and that's those are requirements. I don't see a lot of wiggle room there. There's a lot of talking around it. Casey Means is not a currently licensed physician. And I think she said, well, I could reinstate this. And it's like, well, if that were the case, then I guess you would have done it, right?
Yeah, why didn't you just do it?
It takes like hundreds of hours of like continuing education. It's not just an immediate like turn it on, like pay your fee and turn it on again. It's not a like, I mean, I don't know. I'm speaking around it.
I've talked to a bunch of docs who, they leave and they come to industry. They come and be the CMO of whatever health tech company. Like it depends on your state, but in most states, you have to go back to a mini residency.
You're going to be seeing patients, right?
You have to go back to mini residency. They all call it, it's like, depends on the state, right? I know in Tennessee, it's like, I think it's like 6 months of like, I'm probably saying that wrong, but it is not nothing. Like you have to go back and practice and you basically go through residency in a truncated version again. Like you can't just be like, oh yeah, I just like, send in my payment.
Yeah. Let's
like
just
I forgot
all remember
to register my car.
Yeah. Yeah. MD is a degree. And then being a licensed physician is something different. And, Casey Means, without a doubt, is a very smart woman. She went to medical school at Stanford. She got into a otolaryngology. I can't remember pronounce that. ENT, otolaryngology. I can't say it, you guys.
Something
oh my God.
Fancy.
Otolaryngology. I can't say it right. Whatever. The point is ENT, ear, nose, and throat.
Yeah.
Surgical residency, right? Like not a dumb woman in any way, shape, or form. Like obviously very smart, very talented, but the facts remain, she is not a licensed physician, and that is a requirement for the job.
Yeah. We'll see if Congress came back yet. The Senate came back. I've heard rumblings that they are awake now. It's unclear.
Yeah. Wow.
We'll see what happens.
I really can't say that word. Interesting.
Speaking of Maha, so of course Casey Means is Maha, right? Like we got a lot of Maha stuff going on, and the Maha crowd's really mad at the MAGA crowd right now, right? And the MAGA people are like, we don't know if we actually need you as much as you say we do, and the Maha people are like, fuck you, we're coming for you, you're gonna lose the midterms. Lots of drama, lots of marketing campaigns, and this is one of them.
I am not I'm not into this campaign.
Lisa does not support. Yeah.
That's not what we
Yeah.
need right now. We just need like healthy food, like clean water, clean air, like
Yeah.
no, like, I don't know, Roundup in our water, whatever it is. Like that's what we need. Like let's focus on the fundamentals. We don't need an action figure, whatever.
Yeah. We don't need an
I
action
also love
figure.
French fries, like cooked in beef tallow, but that's not the biggest problem with my health right now, just to be clear.
Yeah. Yeah. It's like the X12 standard.
They
Could
take,
be fixed.
beef
Could be
tallow
fixed.
tastes great. Like it's totally like, I love it too. It's just like, it's not going to solve all of my health problems.
Yeah. Anyway, so we'll see what happens here. I will be interested to see who jumps on the Maha train now, because it does appear to have lost quite a bit of influence, really over just the past month or two. So we'll see what didn't you say we just got an email from Maha Institute.
Yeah,
it was just the Austin thing.
Yeah.
Yeah, I don't know. We'll see what happens. Loyal fans, tell us more if you are on the Maha train as a political movement. I think everybody agrees we should like have clean food and water, whatever. Speaking of, Stat did a nice review of the why behind the, what are they calling it, Glyphogate?
Glyphosate.
No, but they're calling it Glyphogate.
Oh, Glyphogate. That's nice. Love it.
Anyway, it is interesting. And I just read their recap on it, but Stat always does a nice job. They did have it's like a matter of like national defense that we're keeping like glyphosates in our agricultural arsenal, which I think is interesting, because you know what? When we are preparing a nation to be war ready, more lethal, it doesn't matter how long they live, Lisa.
Is that interesting or just deeply concerning?
We just need them fed. And then,
yeah.
We don't need a population that lives long if we're sending them to war. So, I don't know. Reading that, I was like, I just don't like this argument very much. So moving on. Okay, so I put this in here because this headline really pissed me off. The U.S. government must invest more in research around men's sexual and reproductive health. And I was like, no, Lisa, I was like, I saw this and I was like, what the fuck? I was like, I am coming for this guy. It's this guy, Kenneth. Oh, he's being covered up, but you can see his name on here. He's from Harvard.
Kenneth Meyer. He was at the Fenway Institute, which is okay. Are you about to tell me? But actually,
I like to tell you, this is one of those. Don't just read the headlines. The entire article is basically what we all say, which is, do you know to have an unplugged pregnancy, a man has to ejaculate? So let's educate men more. Do you know that all these women have STDs and we work on
this is designed to trick you because you only read the headlines.
Yeah, it was like, since men have more sexual partners and spread pretty much all STDs,
that's right.
We should probably work on them.
That's right. Yeah, that's right.
I read through, I was like, oh my gosh, this is amazing. I was so mad.
Amazing.
And then I was so not mad. So anyway, whatever.
Also, shout out to my favorite show in the world, The Pit, that had the last two episodes have covered, first of all, amazing things. They're covering like a cyber attack in the hospital where they have to go completely offline and do paper charts and teach all the children who work there now, like how to use a paper chart. As just amazing. But also they have a whole episode, like multi-episode arc about a woman coming in who needs a rape kit and the process of gathering rape kit information and like the reporting process and the fact that the police usually don't even like pick up the rape kit, like they just covered like the whole thing. So like shout out to The Pit, because that is a difficult topic and they covered it like really well and really showed like what it takes to actually report like legally and medically and how whatever. So again, those guys are amazing. Love The Pit.
Yeah. Okay, so I think to end our content for the day, Brandon Keeler, friend of the show. As you can see here, it says paid on here. This is paid content. Lisa and I.
She's always bragging that she pays for Brandon Keeler's content.
Okay,
wow.
I pay for everyone's content, Lisa. I'm just saying people should support other people, including the Talk Show. Anyway, so this was just like one of the greatest things that I read all day. Apparently, there were a bunch of motions to dismiss filed, as well as a motion to sever. And I was like, what the hell is a motion to sever? So as everybody may remember, the Epic V Health Gorilla lawsuit names many, many parties, most of whom are named after animals. And so what we found out is that two of these parties, ViVEvent and Mammoth Health or something, Mammoth, ViVEvent went for everybody's jugular. So as you can see here, they aren't friends. And in a newsletter titled "With Friends Like These" that Brendan set out this morning, ViVEvent files its motion to sever from Mammoth because, as they say here, if forced into a single trial, the ViVEvent defendants will be made to sit alongside the Mammoth defendants, whose principal, Daniel Baker, has been convicted in federal court for conspiring to defraud the United States of America. Oops. They should not be forced to defend themselves against the backdrop of this record. Oh my God. So yeah, as you can see here, this little meme, very appropriate. ViVEvent was like, we're coming for you. We're coming for everybody.
Amazing.
So
amazing.
Good. Anyway, it made me laugh.
So good.
Yeah, and Health Gorilla, of course, filed a motion to dismiss, and I don't know. I'm not a lawyer, but it does look like some decent arguments there, mostly procedural around the fact that Epic did not leverage the care quality dispute process, which I have heard in the back channel is actually like a load of shit. So I don't know.
Yeah, listen, I mean, we'll see where all this goes. Lots of people saying things. Lots of muttering about those processes and those organizations.
A lot of muttering, lots of stuff. Anyway, okay. Also, we're throwing a party at HIMSS, if you know, you know. And we're also, Melissa, what are we doing at HIMSS? What are we doing at HIMSS?
We are having a show on Tuesday at 11 Pacific and 1. Sorry, guys, I wasn't prepared. 1. And we're already starting to get some guests. Also, we have a special guest on Monday, so tune in for that as well. That one is already scheduled with the location, which is very rare for us. But just send me a message and let me know if you're interested. And they're going pretty quick because the ones that we couldn't get on ViVE are now here. So Melissa at healthtechtalkshow.com. Please.
Yeah. Do not email me or Lisa. We'll
ignore it.
Melissa in or ignore it. So
or forget about it.
Best case is that we refer you to Melissa anyway. So
that's right. That's
right. Thank you, Melissa. All right. So Lisa, we have a special guest coming on.
Yeah. Al, you're up.
We're going to add him on, but we're going to give him a quick. Well, we'll bring him on, but don't say anything yet, Al. Okay. So we first heard about Al Guida on Signal.
Junior. He's a junior.
On a Signal chat, this was when the SAMHSA grants a couple, maybe a month ago now, were suddenly clawed back $2 billion in grants across the country. And we were all like, who was responsible for that? And we heard from the guts of the federal government on a Signal chat, which we're told is not able to be found, that it was Al Guida, Saved America. And he told us on LinkedIn, no, it was a lot of people, but yeah. So we are looking forward to hearing about the legend of the SAMHSA grants plus more. So yeah. Al, introduce yourself to our loyal fans, please.
Oh my God. Kate, Lisa, clearly you've exercised some poor judgment in having me on.
It's normal for us. Yeah.
So yeah.
We don't have great judgment.
Yeah.
Kat and I are our whole universe of bad judgment.
It is a fake news talk show, so welcome.
Yeah.
So I am a contract lobbyist in Washington, D.C., which means that I'm the lowest form of human life. So Guide Consulting Services is a government relations consulting firm that really specializes in mental health and addiction clients. We have clients that don't participate in that field, but mostly it really focuses in that space. So we represent community mental health centers, state mental health agencies, a couple of tech clients that really focus in the mental health and addictions treatment space, the Coalition for Social Work and Health. We represent a pharmaceutical company that has a product in the space. So we really focus on mental health and addiction treatment policy. And as a result, when all of that insanity went down earlier this year, we were kind of pulled into the vortex of what was complete insanity, I have to say, for about hours.
So there was no notice, right? Like,
No.
yeah, like it looked like you guys pulled something off in like less than 24 hours. Tell us more.
Yeah, what is that? Like, are you like at home, you're like about to have dinner and you get like the dreaded like phone call or email? I mean, I've been in the situation where something bad like that has happened, maybe not quite this dramatic, where you're like, oh my gosh, my like the next X number of days are over. I must cancel everything out. Like, what was the scene, if you can tell us?
Yeah, so I guess I'm trying to reconstruct it. I think I was at home on my couch. I started getting panicked text messages from my clients. And because we have so many clients in the space, we just started getting texts, primarily texts initially saying, hey, we've gotten these termination notices. Do you know what's going on? By the time I got into the office the next morning, it was that tsunami of all of this stuff, right? So by the time I pulled into the garage of my office, I was on the phone with the congressional office that we deal a lot with. It's an office on the Energy and Commerce Committee. Representative Paul Tonko from New York. Representative Tonko's on the Energy and Commerce Committee. He's a Democrat from upstate New York, and he's one of the leading lights on mental health and addiction treatment. And we organized a letter in that phone call that ultimately attracted 100 signatures.
Yeah.
In less than a day. And so that phone call started that letter, right? And then it just got worse from there. Because by then, right? So we had like a bunch of Zoom calls set up. And then, so Lisa Cat, I've been in this business a long time. I mean, I've been a lobbyist my entire adult life, and so a misspent youth, right? So, all right. So we're on the Zoom with these clients. And so they start getting emails from their service provider saying, we got this termination notice, we got that termination. So they're getting real-time termination notices from their providers.
Yeah.
And they want to know from me, hey, what the hell is going on? And I'm trying to find out what the hell is going on. Man, it was just, I've had a lot of bad days in my professional life, a lot of them. And man, this was top 10, easily top 10. Oh, yeah.
Yeah. Do you know any, like, I mean, it sounds like it was relatively easy to get a lot of, support from members of Congress. And it seems like it was pretty bipartisan. Is that accurate?
It was. I mean, I have to say that we've been going through a lot of this. 2025, we went through a lot of it. And what was unusual about this was the Republicans always wanted to go behind the scenes. They didn't. Now, I should say, Kat and Lisa, to your listeners, and I'm sure you have
millions of loyal fans,
partisan audience here.
Yep.
Many members of the Freedom Caucus probably tune in to this podcast. I'm sure they do.
I think they do.
So, and Guide Consulting Services is a carefully bipartisan operation. I want to be clear about that to many of your listeners. So, and increasingly, when I started this thing, whenever that was, oh, hi, Tom, how are you? So when I started this, whatever that was, I've been a contract lobbyist in this space for 25 years. It's increasingly bipartisan, right? So this space is increasingly bipartisan. It was not when I started this in this field 30 years ago. But there's an increasing understanding of the biological nature of these conditions, and then particularly with the pandemic, and then with the opioid crisis that started with the overprescribing of pain-killing medications. Those two events had a real impact in terms of specifically increasing Republican support for these conditions, I have to say. So in 2025, we had Republican support that was behind the scenes. All right, so Democrats would write letters the Republican offices would say, yes, we're with you, but we can't sign letters.
Yeah.
We have to be able to, but we have to be behind the scenes. With this matter, we did get Republicans to sign on to that letter that was led by Congressman Tonico, for example.
That's great.
So that was, I have to say, that was unusual, and it was a first. In all of 2025, we didn't have any of that. And then we began to understand what the circumstances were behind the termination. So we understood.
Was it just like an accidental, like control, like alt delete? Like, was it like what like they said that
What
like doesn't
happened?
align. Yeah, they said that doesn't align with the priorities of the administration, which didn't really make any sense. Was it just like someone like mistakenly like finding a code word and then, accidentally tagging things? What happened?
Control Alt Delete. I love that, Lisa. That's going back, baby.
Control F.
Okay.
Control A, Control X, whatever. Just deleting by accident.
Here's our understanding of the situation. So it came from the White House, came directly from the White House, directly from the Domestic Policy Council. And so here's my understanding. So the OMB, the Office of the Office of
Management and Budget.
Management and Budget, and its confederates of the White House were going through the department seeking at-will termination of grants, and they just got HHS authority for at-will termination of grants at the end of the year, and so they then started going through the operating divisions. And SAMHSA was first up. And then my understanding is, so there are 6 operating divisions within the Department of Health and Human Services. SAMHSA was first up. And then the next operating division was the Health Resources and Services Administration after SAMHSA. They were going to be next up. So, so my understanding is, and Lisa, Kat, you'll pardon me, a lot of lobbying, healthcare lobbying in Washington is like senior year in high school, where you're circulating rumors. All right. So what I'm doing now is circulating rumors, and then the rule in
that's Washington, how we operate, Al. We are
totally show.
That's how we work. Like, we are the rumor mongers. We make them up sometimes. Like, it's us.
We're ready. We understand.
We know. Keep going.
Ours is more like junior year in high school, though.
The rule in Washington is, if you've heard the same rumor 3 times, it's fact. Okay, so the rumor I heard is that they used an AI tool to go through these grants, and they examined the websites and the grant and the submitted grants for the projects of regional and national significance of the submitted SAMHSA grants. So what the clients explained when I was on the Zoom with them is that they had cleaned up the DEI. They were looking for DEI words. So they had cleaned up their websites, but the grant applications were submitted in the Biden administration.
Yeah.
So they had diversity plans because they were required. So all of their grant applications had diversity plans, and so that meant that all of those grants were terminated.
Wow.
So that's why there were 2,800 grants that were terminated, because they all had diversity plans, and that's how we came up with $1.9 billion in terminated grants. Because that was the math that was required as a result of the AI tool. That was my understanding.
Wow.
It's not surprising, because that is what I expected happened, but it's obviously incredibly disappointing. Especially when grants must have been made when there were requirements for diversity programs and connected to it. And by the way, just whatever. You guys, it's almost too stupid to even comment on it, because it's like, obviously that is a terrible way of doing things.
Yeah.
Well, so the way this works is that, for example, what the study shows that there's just a significantly higher level of social stigma associated with mental illnesses and addiction disorders in minority communities, in African American communities, in Latino communities. It's just harder to do outreach in those communities in order to engage them in services, for example. So
yeah,
you have to acknowledge that in your grant applications, and you have to put more time, money, and effort into engaging those communities. I suspect that's what some of the grant applications said. And that's just the reality of it. It's just the way.
Yeah. Wow.
And then what the research also shows is that those communities respond better when the mental health and addiction treatment providers providing those services are persons of color. So if you're an African American clinical social worker and you're serving a patient who's African American, the clinical outcomes are better. That's just what the research says. It's not
about DEI. It's about literally like achieving clinical outcomes, right? And I just, it's just
says. I'm sorry. It's just what that says. I'm sorry. It's just what the
brutal. Brutal.
We want better clinical outcomes. It's just, and then we have a hard time recruiting, right? Like, I think it's like something like 90% of psychiatrists are white. Like 85% of psychologists are white. And so we make efforts to try to diversify the mental health and addiction treatment workforce because we want to achieve better clinical outcomes. It's just, right. I don't want to make controversial statements, and I don't think those are controversial, but apparently they are.
Apparently they are. Okay, I want to get back to like more of how ridiculous all this is, but first, I want to actually understand how you pulled this off. Like, so I get it. Like, you figured it out. You got the letter signed. I'm no lobbyist, but I've launched some senators at this administration too, and like it didn't work. So what did you do to make this work? Because like, holy shit.
So Kat and Lisa, and again, I want to say this is I want to, what I said in the Facebook or what have you was true, right? So this was not, Al Guida did not pull this off by himself. There were many organizations that ran to the defense of these grants. Okay, so I was one of many individuals that was engaged in this advocacy effort. With respect to what I did specifically, of course, I did three things, right? Went out to Representative Tonko. He then got the letter going. His office got the letter going, and then you go to the appropriations committees, right? To the House and Senate Labor HHS appropriations committees, to the four corners. So that's Senator Collins is the chairwoman of the Senate Appropriations Committee, of that subcommittee, the Labor, Health, and Human Services Appropriations Subcommittee. Actually, that's actually Senator Capito from West Virginia. We then went to, there's a senator from Wisconsin we went to that staff member on the minority side, and we did the same thing on the House side. Senator Adderholt from Alabama is the member of the chairman of the House Labor HHS Subcommittee, the Labor, Health, and Human Services Appropriations Subcommittee. And then the ranking member is Representative DeLauro from Connecticut. We went to the staffs, all four of those staff members, to say, what the hell is going on? Why were these grants terminated? Can you weigh in with the administration to turn this thing around? Now, Kat and Lisa, I've been at this for a year. Okay, this is not the first time this has happened. And so what they have said in the past is, this is not enough. Because I've been doing this. I've been a lobbyist again for 40 years, almost 40 years. I'm an old guy. I found love late in life. I have a 17-year-old daughter, so I'm going to be at this for a while longer, right? So this is the play we always pull. And what they have said in the Trump administration is, this is not enough. You have to, quote, make noise, end quote. That's what the Appropriations Committee staff have said to us. So what that has meant is I am now a publicist.
Yeah.
Yeah. So what that means is I know reporters now at the New York Times. I know both of the reporters that cover this space at the Washington Post. I know the reporter that covers this space at Politico. I know the reporter that covers this space at Inside Health Policy. And so I went to them all. And and so here's the thing now. I went to them all in the same morning with the same email. And then they got back to me. A lot of them got back to me, right? So it's not just whether or not they're going to write the story, and many of them did. They just didn't get them out in a timely fashion. It's then they email or they call HHS Public Affairs or the White House to say, what's going on, right? So whether or not they write the story in a timely manner is not really important. It's now they have to respond to media inquiries about what's going on. And that's very helpful. So if they're getting pressure from the Hill and getting pressure from media, that works. I mean, what that showed in this case is those tactics worked, and because it worked with others, right? So we learned from others, right? So when like turning around, there were other subsidies that were cut off that were then turned around because they used the same tactics. So we just used the same tactics they did. I mean, I don't remember the specific examples, but we watched what our other advocates did, and then we just used the same tactics they did.
Yeah. You're like dropping some knowledge here, Al. I'm impressed. That's awesome. Yeah.
I'm liking it.
Again, I mean, just been at this a long time, so that you pick up a few things along the way. I mean, whatever scruples I had, whatever the hell it is, those were left by the side of the road sometime in the late 1990s.
Well, we agree about the publicity thing, right? So neither of us are registered lobbyists, but we certainly work on the edges of this world in the sense that if you need something to get done, sometimes getting the media involved is important, right? Sometimes there's, bringing light to something that wouldn't otherwise get light, and that might get then the attention of somebody who is a decision maker of some kind, or a lawmaker, or writes a regulation, or whatever it is, right? You gotta bring some light to the dark places at times, right?
This administration is essential. And then what I'd say here is they just seem to have a hard time defending it, right? So the individual programs providing Narcan in prison settings. One of the programs provided residential treatment for women, residential treatment for women with kids.
That's we philanthropically support one or a few of those, and
just having a hard time. Once you got down into the details, it was impossible to defend some of these individual program cutoffs. So that's the question I got, right? Well, tell us about some of these individual programs. Well, some of them are, prevention. Some of them are the provision of Narcan in emergency rooms. Some of them are the provision of intensive outpatient treatment for newly released individuals out of prisons or county jails. It's almost impossible to say that's the wrong way to spend federal dollars in the mental health and addiction treatment space. So I have to say that they were just in a difficult position because you can't defend this stuff, right? You just can't. Well, those are wasted federal dollars, right? So once you force them to articulate why it is that these are bad programs, they can't. And when you can't defend them, and you have to defend them in front of major media, in this case, they retreated. And I have to say, I felt what I thought is, and I know we're running short on time. What I said to the clients is, hey, look, we're gonna, because the bill was in conference, the labor health and the FY26 labor health and human services appropriations bill was in conference. So my ask to the appropriators was, hey, we need an amendment. So we need an amendment in the labor HHS bill that will roll back these terminations. That's what I thought we needed. I didn't know that we're gonna pull it back on their own in 24 hours.
Yeah.
That was a shock, because the Trump administration doesn't do this. They always double down. They don't do that. And so, whoa, baby. I mean, that was a shock. I mean, that was, baby. I should have asked for retainer monthly increases right after that. I failed.
You should have. Absolutely. You can.
That was the time, Al. That was the time.
Yeah.
Oh man.
No, I mean,
when you achieve a tangible outcome for your clients, and you're like,
yeah, well,
the roof's going up.
Yeah, no, I mean, but Al, like, even to get to the point where you even had to get them to articulate the point, right? Like you said, like the Trump administration like digs in and they go, like they get mad and they won't even respond.
Yeah.
So the fact that I mean, again, I know it was a big team, blah blah blah, but like someone was leading this, and like clearly you were a big driver. That is super impressive.
Kat, I really appreciate it. Again, it was a big team, but I really appreciate your statements here. It makes me feel good, and most of the time I don't feel good about most of the stuff we're doing over here. So I really appreciate your statements today, however incorrect they may be.
Well, no problem. It's no problem. But yeah, I mean, like at least some of the articles that you spurred on with the media, right? Some of them said the secretary actually tried to defend the decision to cut. So I do wish we knew who exactly was the one to reverse it, because we would shout out that person, but whoever they are, I'm grateful.
That's right.
He's a great American.
Freaking patriot. Yeah, that's what I'm
Whoever
talking about.
you are, sir or ma'am.
Well,
we commend you.
I mean, this was like super. Actually, this was like super fun to hear like the inside story here and all the dirty dirt. But do you know of like, should we be bracing for anything else in the behavioral health grant space?
Well, so here's the thing. Now, I've asked the same question to the Appropriations Committee staff. So what they tell me is that on the CDC side, there have been widespread grant cancellations, right?
Yes.
So again, they're going, OMB, the White House are going through they now have this at-will grant termination. Now, what's occurred in the labor HHS, the FY26 labor HHS conference report, which was signed into law, is that they have narrowed Russell Botts, who is the OMB director. It has narrowed his discretion. They have to provide 30 days notice. And they have, in the CDC context, OMB has been providing 30 days notice when they engage in these widespread grant terminations. On the CDC side, this is what the Appropriations Committee staff told me on Tuesday morning in a coffee. The thing is, if they give you 30 days notice, you could do a lot of damage.
You can do a lot of damage.
A hell of a lot of damage in 30 days. So I don't. Do I think we're out of the woods, Kat? I don't know. I mean, I really don't know. What I would say is there are procedural protections in place that will give us a chance to defend ourselves. And that's all a lobbyist can ask for, is the opportunity to defend, to defend ourselves. Yeah.
Spoken like a true patriot, not necessarily the lowest form of life. So, well, Al, this was actually so fun. Thank you to our loyal person deep within the great federal government who gave us the tip on you and got you on the show. This was a pleasure. So we're probably going to have to call you next time something dramatic happens.
Yeah,
so,
we know who to call if there's something else goes down in this space. Yeah, it's great
and
news.
Lisa and Kat, I would love to talk with you about AI and mental health. I know quite a bit about chatbots and oh baby.
Oh,
all right. Melissa Danino
Melissa.
is ready to talk, but
Yeah.
me too. I'd like to talk to you as well, Al. So we'll follow up, and thank you so much for being part of the no doubt large and secret team who reversed this really huge mistake. And we even though lobbyists are oft hated, we are friends of, and we love your work, and keep going.
Yeah.
Way to go. Thank you.
Be like Al, loyal fans. Be a patriot.
Be like Al. That's
Save
right.
America.
That's right. That's right.
All right. Thanks. Al.
All right. Bye, everyone. See you soon.
See you later.
Bye.